We're about to hear from Dr. Chambers during our keynote session today titled Transforming Patient Care and Engagement Using Social Media. It is really my utmost honor to introduce her because not only does she know what she's talking about, but it's so relevant to us. She's a medical doctor specializing in obstetrics and gynecology who's hashtag changing the cycle. She brilliantly leverages the power of social media for the greater social good. She's innovative, resourceful, truth-telling, and demystifying health and healthcare one post at a time. She'll be speaking with us today about ways that health professionals can enhance their patient experience, as well as sharing information and resources that are person and community-centered. Dr. Chambers believes that folks should have access to information that allows them to understand their bodies, protect their bodies, plan and manage their periods and/or pregnancies, and do all of this free of judgment, coercion, and marginalization. It is time to change the cycle and all the cycles, and Dr. Chambers is leading the way. I pass the mic to you.
Thank you so much, Anna, for that amazing introduction. Oh my goodness, I cannot tell you how excited I am to speak with you all today. So I'm going to pull up my presentation on my little share screen, and I famously go to the wrong slide to start with. I don't know why I do that. So I'm going to see if I can actually get to the beginning of my slides here. Let me just see here. My apologies. And thank you also to Suzanne for kind of showing some of my posts. I love being able to reach folks on social media. And I'm just going to kind of talk with you in the general sense about social media for the clinician, how to use social media to achieve transformative patient engagement. And I don't just use that in some lofty kind of catch-all, tantalizing title. I truly believe it and I live it. And so that's why I'm super excited to share with you my journey, kind of the background of social media, because a lot of folks, especially in kind of the healthcare field, are like, what is this social media thing about? Like, what are we even doing? Why do we feel like this is relevant? Why are we here? And so I try desperately to kind of talk about that and why the relevance is actually very real. So I'll talk about a little bit about me. So my background is that I went to Spelman College. I attended medical school at UAB, which is in Birmingham, Alabama. I'm from Alabama originally. I went to Greenville Health System for my OBGYN residency. And then after that, I attended fellowship in Houston, Texas at Baylor College of Medicine, where I just love my training, had the privilege of just kind of refining my skills as it relates to my subspecialty, which I enjoy so very much. And then in 2019, and that's really why I'm talking to you guys today, I founded the Period Doctor platform. And so that was super fun and really the basis of my discussion with you today. And I'm just going to walk through what that journey has looked like and kind of how it came to be. So to start, my objectives, I want to review the evolution of social media and the difference between the available platforms. I want to discuss the literature that supports that there's some intersection of healthcare and social media. Of course, I'll share my personal social media story, and then I'm going to propose some potential ways for clinicians, to start making your own mark on social media. So, as Charles Darwin says, it is not the strongest or the most intelligent who will survive, but those who can best manage change. So let's get into that. The evolution of social media. Ultimately, how do we get here? What even got us to this place in which there is this discussion about how we can incorporate social media into medical practice? Like, what even is this? So in 1991, the World Wide Web was created. And that really opened the opportunity to use the internet to communicate via text. And so in 96, we had Google, which is such a wild concept because now we've just seamlessly incorporated Googling and into our everyday lingo. And it's like we can't even remember a time in which we didn't have the opportunity to just Google something. If you don't understand it, you Google it. If you need more information, you Google it. Google's a part of research and presentations and everything that we do on a daily basis. And that started in 1996. Then we had Blogger in 1999, where folks are actually just kind of blogging in long form to communicate their ideas or opinions or lifestyles to others. others. Wikipedia started in 2001, 2003, we got our MySpace and our Facebooks, with Facebook really being kind of that leader of like the social media platforms. 2005, we got YouTube. 2006, Twitter jumped on the scene. 2010, Instagram and Pinterest. Snapchat in 2011, and then TikTok, which is all the rage. And 2012 really got popularized kind of later in 2014 to 2016 in the United States. So there was actually a research study. The Pew Research Center looks into kind of the use of social media in the United States. And it showed that in 2019, 72% of American adults used some form of social media. In 2005, the year after Facebook went live, that number was just 5%. And so that speaks to the kind of exponential growth that we have seen over the last decade, 1 to 2 decades, as it relates to social media and the use of social media and just what it means in our daily lives. And it's everywhere. Like even the majority of our news stories are constantly covering social media, anti-troll tools on Twitter, just how this affects our dopamine kind of receptors and turning us into dopamine addicts. And then social media kind of increasing child safety. It's everywhere. It is a part of our daily lives. And quite frankly, it is not going anywhere. And so that's kind of how we got to where we are today. So today, social media is used by more than 5 billion mobile device users worldwide. And if you know anything about the global population, it's about at 7.9 billion. So a lot of folks are using social media. If you want to reach people, that is where you need to be. So a little bit more about kind of social media and how it's in the United States. And I believe this was actually from an article in 2020 and kind of looked at research back in 2018 and beyond. So the numbers are a little bit outdated, but ultimately it still speaks to the majority of folks utilizing social media platforms. And this is US adults, about 72% using some sort of social media, a little bit more, like 73% using YouTube, because a lot of folks use YouTube that may never use a Twitter or an Instagram, but it's a great search engine for videos. 69% using Facebook, and then 75% using Instagram, Snapchat, all of those things. I mean, the vast majority of folks are using one of these platforms, if not multiple. And then just the increase of digital advertising. And that's kind of where you can see where influence and reach is. If the money is there, if that's where people are trying to reach folks when it comes to advertising, this is where the people are. The money and the advertising always goes where the people are. And so this is from 2018, but online revenue was $107.5 billion from an online market standpoint. The TV revenue was behind that at 70.9 billion. And then radio and newspaper magazine just kind of were left in the dust because they're really kind of just, something of the past. They're becoming not entirely obsolete, but certainly being replaced largely by the social media online kind of presence. So let's talk about the different platforms, because I know that there could be some level of confusion there. And quite frankly, there is some overlap in the platforms. And so if you don't get it all today and you don't fully understand it, that's perfectly fine. You really just need to find a platform that works best for you. So to start, we've got our Facebook, right? It's really the prototype of platforms. It was the platform that did it right, had crazy amounts of growth, and really set the stage for what social media looks like today. It's an estimated 1.7 billion users worldwide. And as I mentioned from the other article, about 69% of US adults use Facebook. The largest represented age group for Facebook is actually between the 30 to 49-year-old demographic. And that's just relative to the other age groups. So who's actually on Facebook? YouTube, again, is the largest video search engine in the world with over 2 billion users worldwide. 81% of US adults have used YouTube or use YouTube in like a monthly basis. And the largest represented age group in here is 18 to 29. You're really going to see that 18 to 29 being prevalent in the majority of these platform demographics. And that's just because that's the group that uses social media. That's the group that kind of grew up with cell phones in hand and tablets and all of those things. And so social media is a part of their daily lives and more incorporated than maybe some of our older adults in the 30 to 40 age group. Twitter was considered to be like a micro blogging site. And so the idea was not so much long form blogging, but that you would type kind of character limited phrases and thoughts and kind of engage in discussion. It's not really meant to be like a photo sharing, kind of video sharing kind of site. So when it goes to like Facebook, for example, that was where they had albums and, photos and videos were a part of it. Certainly, YouTube definitely video focused. No one's reading some long paragraph on YouTube, but Twitter was meant to be a place where, you know, thought leaders and people who have a lot to say and don't necessarily want to post a selfie every day. That's where they kind of were found, and that's kind of the community for those types of things. And certainly, there's a lot of legitimacy with Twitter over the last, you know, several years, where a lot of official kind of news literature comes from Twitter. So anyway, 23% of US adults use Twitter, with the largest represented age group, again, still that 18 to 29 age group. Instagram was founded as a photo sharing site. That was truly the intention. Instagram, that was the whole kind of idea behind it. Of course, it has changed. We've got these captions that can be very long. I'm one of those people that loves a long caption. I still need to kind of erase things to fit into the caption limit. And certainly we have switched over to video sharing and things like that. So more than 1 billion users worldwide, and 40% of US adults do use Instagram. Again, the largest represented age group is still that 18 to 29 age group. Then we got our friend TikTok, which is like the new kid on the block, certainly a force, and definitely a force from a marketing standpoint. But it was founded as a short form video sharing site. There are more than 800 million users worldwide. 21% of US adults are on TikTok. The largest represented age group, now this is from the Pew Research Center rather, and they really looked at adults only. So that says the largest represented age group is 18 to 29. But if you look at a larger demographic that includes, kids that are under 18 as well, you really see that a fourth of the users on TikTok are between the ages of 10 and 19. So that's really where you want to go if you want to reach a much younger age group. If you're trying to reach the teens and tweens directly, that can be, your preferred platform, because that's where they are. And so really understanding the platforms, and these are just kind of, overviews of the platforms, but understanding them and really kind of tinkering with them and seeing what works best for you and what you're trying to convey is super, super important. So let's talk about the intersection of social media and healthcare. So the thing is, with social media, you can disseminate information widely and quickly. And for that reason, we can use it. Health institutions can use it to post health information and share that information with the greater public. And so it just kind of makes sense. And that was really my thought process when I was getting involved in social media. It's like, hey, I can reach a ton of people here. And then you look at other things. So as Suzanne mentioned, social media is used by a number of folks, and I use it in a number of ways to reach my patients, but to reach their parents, to reach their teachers, to reach their fathers, siblings, partners, to reach other care providers. And so social media is being used by a ton of folks in a number of ways. So social media is used by 80% of cancer patients to connect with their peers. There are communities in social media that create support groups that were once relegated to just meeting somewhere in a church basement somewhere. So if you couldn't make it to that support group, you couldn't get there. And so social media has allowed there to be certain sectors of community, and community is needed within the patient population as well, from a patient-to-patient standpoint. And then for healthcare organizations, more than 80% of US health departments have social media accounts. That's huge. And then even among health professionals, there's a lot of health professionals on social media. I have no idea why they selected radiologists, but they said 65% of radiologists across the United States and Europe use social media for various health-related reasons. And so there is relevancy an application within the social media land to kind of healthcare and the healthcare sector. There are other advantages of using social media over other sorts of media outlets. And so social media is seen as, fast. As I mentioned, it is the fastest among the available channels to share alerts and updates, especially about disease outbreaks. And so a lot of this specific article that I referenced for this was referencing social media in the age of the pandemic, which is when social media really kind of just came up to the front stage and showed us how powerful it really is, in good and bad ways. So it also allows us to leverage various media forms. So I can integrate a hyperlink into my post that then directs folks to, youngwomenshealth.org or Planned Parenthood or any other kind of reputable online resource that I want my patients to understand is a good resource for them. So through my page, I can then kind of guide them, to another resource, which is really cool too. And then, of course, we can communicate with other stakeholders. I can communicate with other physicians, some other healthcare providers, nurses, medical students, other people in training, and even news outlets, to really communicate regarding the status of things. And, of course, they're referencing disease outbreaks, certainly, and that's been relevant as of late. But there's a lot of official information and sources that have come from social media that they can then be incorporated by journalists in a very timely manner, very, very quickly. I've had multiple tweets and posts that are incorporated into magazine articles and news articles because that's where you get your information. That's where you understand what's going on, how people feel, and that's where authorities on these matters are located. And then, of course, there is the glorious and never-ending, heartbreaking, tiring war against misinformation. And of course, with COVID-19 and the pandemic, we really saw this kind of come to the forefront. There was an increase of misinformation during the COVID pandemic, so much so that researchers were suggesting that health institutions actually do something about it. So what they wanted was that health institutions and providers increase efforts to monitor and enforce fact checking of these crazy and dubious kind of posts, to promote strategic and timely refutation of this misinformation. So I want to refute this as soon as possible before a bunch of people see it and it becomes a bigger deal. And that's certainly something that a lot of my colleagues and even myself kind of feel an obligation, a mandate to be on the front lines, kind of combating this misinformation, because anyone with an account can post something like, oh, this concoction helps with this. And then you've got people, getting sick or dying even from the actions and results of incorporating and getting access to misinformation. We are also called to share personal experiences in social media. And so one of the things that I did, not that there's anyone specifically calling me to do this, but it's just a general consensus that we share these things, especially with vaccine hesitancy, just posting that I was vaccinated and why, and just leading by example in a sense. And of course, redirecting users that are asking these health-related questions to reliable information sources. So the CDC says this, the public health kind of websites and schools say this. And so I think it's a super relevant thing, and it's just very timely. There's a need for social media engagement from the healthcare sector. So I hope that was, that was meant to be a little bit of a background. I think I may have spent a little bit longer there than I intended to, but I do want to get to my story and just how I became involved in social media to the degree that I am. And so this picture means a lot to me because I think it kind of captures a lot that can't really be seen. So when I first started my social media account, it was in the summer of my fellowship. I was just between my first and second years of fellowship. And so when it comes to medical training, there's 4 years, of course, of medical school, 4 years of residency, OBGYN residency. And so I was between my first year of fellowship, which was right after my residency, and my second year. And so I was, for lack of a better term, just tired. I mean, really, and I was just tired and just looking ahead to a whole nother year of training before I could be real, before I could be a real authority and be out here, participating and affecting change in the way that I wanted to. And in my fellowship, because I was doing pediatric and adolescent gynecology in a dedicated sense for the first time, I really found the degree of misinformation and poor health literacy to be astonishing. I would have just general conversations about periods, just what a period is, the appropriate length and what is occurring in your body when ovulation happens, and things that I just think are fun and I like explaining. And I would find that a patient and their mother, or a patient and their grandmother, guardian, father would just be like, what? No one has ever explained this to me before. Oh my God. I mean, just the shock of just a minor, 2-3 minute discussion on basic physiology, basic anatomy was received with such appreciation. And I just remember just like, why don't we talk about this more? Why isn't there better education? Why don't we do this more often? And there are a myriad of reasons why that's the case. With schools not necessarily prioritizing sexual health or not prioritizing accurate, like medically accurate sexual health, and just the taboo around talking about, the female body or talking about sexual health and reproductive health. There were so many reasons why this was happening again and again every time I encountered a patient and guardian pair. And at first it was kind of cute because it made me feel very special. But after that, I was just very frustrated because we were having the same conversations and everyone had the same questions. And I felt like I wasn't doing enough. And so I started to think about it and I said, if I scheduled a 30-minute new patient appointment every day for the rest of my life, I would never reach as many people as I could possibly reach on like Instagram. Okay, and this was back in 2019, so it was pre-pandemic. I didn't know the world was going to shut down and everything would be remote. I didn't have the ability to predict that, but I knew that if I wanted to meaningfully reach people where they were, social media would be the best bet. And I felt that way because, even when I would see my patients in our clinics, and so we had pediatric and adolescent gynecology, the access was there, but you had to get to us. You still had to have a parent or guardian take off work and get to us, have childcare for your other younger siblings and get to us. And so that's still a barrier. It is not meeting people where they truly are. And so I noticed in kind of my patient demographic, I wasn't seeing a lot of minority patients sometimes, or they would have trouble coming back to their visits. And so I said, these patients often still have access to some level of social media, be it on a phone, an iPad, a computer, a friend's phone, somewhere. We can reach them where they are if we can get on social media. It doesn't require, payment, subscription, it can be very anonymous. No one has to actually even follow. They don't even have to comment. They can just watch and learn. And so that was kind of my thought process on entering the social media space. But I must say, when I told some of my co-fellows and other people, they were just, it was a lot of hesitation and doubt and just like, why? Why would you add that to your plate? Why would you think that social media and healthcare kind of go together? Who does that? And I just felt in my heart that this was an important step, that this was going to allow me to get my message, which was a message of health education in a way that people can understand it, that was free of judgment, that was able to be flexible and be modified according to levels of health literacy, that could approach and address with sensitivity, cultural kind of factors. All of those things I wanted to do. And I was just in a place where my training was such that it was just a whole year from graduation and I wanted to start making an impact. So that was my backstory. So I came up with the period doctor. And my thought process was simply, that's what I wanted to focus on. I wanted to distinguish myself from other OBGYNs in that I'm not focusing on pregnancy, menopause, fertility, conception, any of those things that are really popularized and somewhat saturated in the social media sector because there's a lot of money making potential. I really wanted to focus on the adolescent and the menstruator, the person that is just trying to manage their periods and figure out their bodies and live their best life. And so I said, I want to be called the period doctor. So I'm going to go with that. People will understand what I do right up front. There's no discussion, no confusion. And it's a gender neutral name, which was super important to me. I didn't want to just be Dr. Charis. And I love my name, but my name is not the easiest to pronounce. And so, the period doctor is easy. It's recognizable. I spoke with a friend of mine who's incredibly talented and creative. And I was like, I need a logo. I need something to make this real and tangible. Just because if you type out the period doctor, it doesn't have the same kind of approach. And so we came up with this cute logo using a uterus as the T in doctor, which of course I love. Anything that has a uterus or an ovary or anything, I'm like, oh, I love this so much. And so that was my logo. So I felt really grounded and really cool having a logo. I posted to my personal Instagram page, hey guys, I'm launching something. It's a passion project. I'm so excited. And I chose a launch date. I said July 1st, 2019 is go time. And that was part of kind of just, moving forward and committing to a date and putting it out there so that there was some accountability. And so I said, who am I? Well, an OBGYN with fellowship training in pediatric and adolescent gynecology. That's who I am. But I wanted to be more specific. So I said, let me come up with a mission. What is my goal here? What is it that I wish to contribute? And so my mission, and this was my initial mission, I've gotten a little bit better as far as kind of gender neutral language. And so my updated mission is more to educate people, teens, on topics related to their reproductive health in an effort to promote greater self-awareness in everyday life. So I just want them to be more self-aware everyday life, moving throughout the day, going to work, going to, basketball practice, going to a track meet, just being able to navigate spaces with authority and with understanding, having greater self-esteem, especially in relational encounters with partners, intimate partners, with peers, understanding that their body is appropriate or what's normal, that there isn't something abnormal about, different breast sizes or breast asymmetry or labial asymmetry, or all of these things that we know as doctors are okay in normal variants, but we don't put out into the world to reaffirm this for our teenagers who are going through body kind of and self-esteem issues. And then greater self-advocacy. This is super important to me because I don't want a recluse teen that feels like they have no voice when it comes to interactions with medical providers. I want desperately to promote great self-advocacy because I feel like that's when the doctor-patient relationship is optimized. But that wasn't enough. I wanted to do a little bit more. So I said, let me think about my bias. Like, what is my bias? Who am I? You know, it's great to say, I just want to educate people, but I feel so strongly about this that I need to kind of clarify this picture so that you really understand who I am. And my true bias, as in if this colors everything that I do, is that women and menstruators, you know, should have access to information that allows them to understand their bodies, protect their bodies, plan or manage their periods or pregnancies, and do it all free of judgment, coercion, and marginalization. Because that's what I care about greatly, that you are empowered and so thereby liberated to manage your bodies, your periods, your pregnancies, all of those things, so that you can achieve all that you have to offer in this world. And do so, you know, free of judgment, because it's one thing to offer something and still judge. It's one thing to kind of, you know, manipulate and coerce someone into doing something. It's one thing to then marginalize a population, say, yeah, it's there, but you got to go through hell and high water to get to it. And so that's what my bias was. So I really wanted to include that. And then I came up with, you know, a kind of catchphrase / hashtag that I use, hashtag change the cycle, or it's time to change the cycle. Obviously, that's kind of play on words, changing the cycle of generational misconception, but also changing the cycle, the period cycle. And so that was my framework, kind of my outline that I started with. And this was well before I posted much of anything. It was just to ground me so that I knew where I was going. So I identified some gaps that I wanted to fill. And I'd like to just pause. These pictures that I'm showing you, the very first one that I showed sitting at a computer, and this one, I was in my apartment building, in like the common area of my apartment building in Houston, Texas. And I had a photo shoot because I said, well, if I want to be using Instagram, I have to post pictures. And so I bought this white coat off of a social media site, off of a website called Metalita, which I love and still actually work as an ambassador for occasionally. I needed a good white coat that I could film in to show that I'm a doctor, so that there was some visual representation, you know, and visual marketing, so that you know that I'm a physician. This is what I'm doing, and not just some girl in a pink dress necessarily. I mean, I still do things in a pink dress, but just for the purposes of getting that brand across and brand recognition, I needed a white coat. Threw in a stethoscope and had a photo shoot. So all of these pictures are all from my very first photo shoot. I had no idea what I was doing. I had never posted anything. I just knew that I probably needed some pictures to be able to post. And I looked insane as a fellow that was busy and running around. So I might as well get dressed up and take some pictures on the weekend. So that's all of the background there. So gaps I wanted to fill. I wanted there to be accurate and accessible adolescent gynecology, as I mentioned. Although we had adolescent gynecologists, you know, in Houston, Texas, in this area, we went to some community areas. Even getting to that office, getting to that clinic, even learning about that clinic was something that only occurred when people overcame multiple barriers. You know, barriers as it relates to transportation and parent willingness to bring them in, and, you know, childcare services for other siblings, all of those things. So I was very aware of that, and I wanted to reach people where they were. I wanted there to be minority representation. It is not lost on me that I'm a young Black female doctor. There's only 2% of Black women that are physicians. And so I still get messages today from people that say, the fact that I even see you, it's just wild. I didn't know people like this existed. I didn't know you existed. It's so important to have this representation. I've had parents show their daughters my videos, and daughters being like, well, play it again. Is she a doctor? I've never seen a Black doctor. And so that seems kind of odd, but it's reality. People live in a number of areas where there's significant segregation and differences in socioeconomic backgrounds, and people don't always get access to seeing that certain things and certain roles and certain opportunities are possible for folks that look like them. So that is very important. Likewise, just encouraging underrepresented, and I don't even like the term underrepresented, systemically excluded or excluding, medical students and residents who are struggling through training. Training is hard. There's so many steps and times and places where you feel like you can't make it. I mean, if there's a 10-year time period from start to finish, it's going to get tough. And so just encouraging them. I've been there, tough and concerning and challenging things happened during my training. There were days where I felt inadequate, all of those things to encourage trainees so that we do get to the other side, so that our physician population does increase in diversity, so that we are better suited to care for the patients that we have in front of us. And then increasing exposure and awareness of pediatric and adolescent gynecology in general. There's still people that I see in my clinic today, they're like, I had no idea this existed. And a lot of folks didn't. And that was really frustrating even in my training, because we had such a strong presence in Texas that people just still didn't know that this subspecialty existed. And I realize and recognize, it's a rare subspecialty, but that's why I want folks to know about it. And that's another great thing. If you're trying to let people know, there's pediatric endocrinology. There are doctors who can specifically speak to kids about, their metabolism, their metabolic syndrome, their insulin resistance, decreasing risk of diabetes, or intervening before they become diabetic. All of these things need to be things that people know, so they know who to ask for, what referral to ask for, and that in turn improves access. And then just showing the humanity in medicine. I am a human being. I have a sense of humor. I like to wear pink. I can be feminine and fun. I can be very proud of my curly hair. I can wear my straight hair. I can, stand up for women's rights. I can fangirl for Beyonce and still be an incredible physician. And that is super important. And taking it out of this crazy faraway ivory tower of people that don't care about the general population and saying, not only do I care about you, I am you. I am a patient too. I've been on the other side of medical racism. I've been on the other side of sexism, and connecting with our patients to show that we are real, that we are human, that there is compassion on the other side of healthcare. I think that's super important. So just a quick order of events, and I think I'm just taking way too long, but I'm almost done. I initially started by securing my handles for Instagram and Twitter, securing the URL, theperiodoctor.com. I applied for trademark of the Period Doctor, reviewed my institution's social media policy. One of them was that I couldn't have a white coat or an emblem or a logo of Baylor College of Medicine, which is why I had to purchase my, just standard blank white coat so as to not, go against my institution's social media policy. So that's super important. Almost every institution has a social media policy, and that's just to cover them. They have to protect their brand, protect themselves. Social media is a slippery slope, and so they want to be very careful. So review that first. Then I scheduled that photo shoot that I mentioned, downloaded an editing app, and I'll talk more about apps, and then I posted my first Instagram post. All of those things occurred before I posted my first Instagram post. This is my first Instagram post. It's from July 1st, 2019, and I just said, I'm excited to get started with the important work of discussing topics related to women's health. Check out my YouTube and all these things. My YouTube still hasn't been fully launched because managing multiple platforms is hard. And then join me on this journey as we change the cycle. These were my first posts. I was just using an editing app to kind of create some stuff, and it sometimes worked. A pelvic exam is not the same as a pap smear. It was hugely popular. Asking for a friend Fridays, I talked about things like UTIs, things that people weren't super comfortable talking about. Vaginal steaming was something that just kind of came up. And so it's a give and take when it comes to content production, but it still needs to be promoting the brand that you are committing yourself to. And I kind of shifted a little bit, had another photo shoot, and had some things where we talked about just kind of parents and why, it's important to have that private conversation. Parents, it's time for you to, check in with your period or your daughter if they've had a period in the first 1 to 3 years, because it's not true that anything goes. You can quick start your birth control pills, combating the idea that periods are natural. So you don't need to mess with them. Yeah, so are natural disasters. And so these are all addressed in touching on different topics and different audiences. And then other key team members, a technology person. I had a person design my website, and I always have someone kind of edit some of my ideas. Most of my posts I do edit myself because I don't know. I don't have the time or so to teach someone exactly what I want my brand to be. Content, I need a photographer, videographer at different times. Hair and makeup, I typically do my own because I want to save money and I'm kind of a budgeter. But having someone style me, I've had a stylist. And having someone review contracts and give me some stock responses like, I'm a medical doctor, but I'm not your medical doctor. I cannot respond to this. I cannot give personal medical advice. I wish you the very best. And I, recommend you speak to your doctor about this. And then my reviewers, my little sister is a professional content consumer. And so she works as the perfect focus group / test audience. So if she doesn't understand it, if I'm using too much medical lingo, she'll let me know and I can change it. And then my posts kind of shifted to things that can be shareable. They can just be text posts, things that, speak to fathers. And that was around Father's Day. And then, of course, the videos that Suzanne posted more recently, just because, desires on social media do change. And so my content has changed. And so, I was offered my first paid speaking event in like October. I launched my website. I created my LLC, I reached 50,000 followers, and then I became Instagram verified, which just means they put this little blue check by you to say that you're a real person, which is kind of cute, and it definitely improves visibility and kind of makes you a little bit more official. So advice for clinicians: when you're starting, identify your message and mission. Find a mentor or model for inspiration, select the best platform for you, and trial ideas with family and friends. And then once you do that, refine your content. Never stop learning. There's apps like Canva. Canva is very popular. Over, which is what I use, InShot and Mojo are great for videos. Canva and Over are great for kind of photos and other content, post story content. All of these are great apps to consider if you're trying to have a social media presence and you want to have some sort of aesthetic kind of appeal. Social media isn't just a trend, it's a tool. And just like any tool, it has to be used wisely. One of the things I kind of caution people is that social media never sleeps and it never deletes. So you need to be mindful of the time you spend on content and engagement, because you can burn yourself out, and be thoughtful of your approach so you don't say crazy things. So when you're posting something, make sure it's relevant, make sure it's relatable, and it doesn't just appeal to you, and make sure you're being respectful. In this time of medical misinformation and truly fractured trust with medical providers, the government, and everything related to kind of medicine and disease management, social media is key. So I believe with proper use, it can truly transform patient engagement and help strengthen the connection between patients and providers. These are my references. This is how you can get in contact with me. And I know we don't really have a lot of time for questions in this time. I think I kind of sped through some things, but I can kind of speak to a few more points if we do have more time. Do we have more time?
Please do. We've gotten a lot in the chat of thank you. This is great info. Well, is this recorded? Can we share this? And then a specific one we have: how do you find the time to maintain your social media presence while also providing clinical services?
Yeah, so I mean, it's all about balance. And I think I love that question so much because it has changed. When I was in fellowship, it was very hard. And so I actually posted most of my posts while I was riding the train. There was a light rail that I took from my apartment to the Texas Medical Center. It was about a 15-minute ride, and I posted most of my posts on that train ride. I was luckily studying for my oral boards. And so I was studying in topic related things. And so I'd say, this is a great topic. I'm just going to post about this. And so the idea was to practice understanding that information and getting the most up-to-date information, and then kind of reframing it in a way that can be digestible by the general population. And so I did that on the train on the way to school. But as I began to be a little bit more engaging and have more photos and videos, that became a little bit more challenging. So I kind of do stock filming all of those videos that Suzanne showed about preconception visits and Black maternal mortality. I filmed that all in one day, y'all. And I was, just in my home with a good ring light. And I say, I'm going to carve out 4 hours this day and just knock out some content, and I'll edit it later and post it, later on. And there are times in which my life is busy. I just bought a house. I'm running around like a crazy person. I won't post for a week or two, and that's okay. I think, there's a lot of unwritten rules in social media where you have to be present all the time, and you can't miss anything. You can't be too late, and you can't not respond to a comment. And that's just not feasible. I am not a full-time content creator. I'm a physician. I'm very proud of that. And my patients come first. I'm happy to be able to kind of have an extension of medical education and just kind of giving of myself and sharing and engaging on social media. But that is not my top priority. My top priority are the patients that I saw this morning. So I plan to have a full clinic day today, as I did from a morning standpoint, and then switching over to speak with an audience like this. And so it's very thoughtful planning. I'm very picky with my schedule, and I don't have a publicist or anyone else that does my social media planning or engagement because my schedule is so specific. And when I need a break, I take a break. I also try to be thoughtful about the events that I do accept. I've been looking forward to this event for over a month because Suzanne was so thoughtful, reached out very early on, and kind of lining those things up so that I have plenty of time to prepare and work my schedule and block things appropriately, make sure I don't have surgeries. That is how I manage it. And I manage it because it's important to me. It is my heart, it is my passion. And when you're doing something that you really care about, you find a way to make it work.
Thank you. Do you have any, this is a question that I have, do you have any patients that follow you on social media and that do they have questions about, do they pull up your videos and ask questions about something you
Yes.
said? Does that spark questions that you've noticed in the waiting room or in the
Right.
visit?
No, I certainly have. So I've had some patients that walk in and maybe the patient isn't quite as excited, but the mom might be like, oh my gosh, I follow you on Instagram, and so I knew my daughter had to come. The daughter's like, oh my gosh. Or I've also had patients that they'll ask me a question and I will have explained it so much better in my social media post, or I'm like rushing or something. And I'm like, hey, while you're changing and while I have to, do a procedure next door, watch this video. And I did that like with my tampon insertion video. Watch this video and let me know what you think. And then we'll practice inserting a tampon when you come back. And that's one of the things that I just do for my patients because no one teaches them. If their mom didn't use a tampon, they don't know how to. And so they'll ask me, they're like, I would love to learn how to use a tampon. I had a patient do that and she did a perfect job. She placed it perfectly her first try. And we were like celebrating, in the room, like, yes. But watching the video, because I had my little vulva puppet and I had all the areas kind of highlighted appropriately, was appropriate. And so I can incorporate that into certainly my clinical life too.
Thank you for sharing. Go ahead.
Any other questions?
Yeah. Another question in the chat. How has what you were offering on social media impacted your care encounters? Meaning, does providing this basic info give you more time during your clinic to cover more specific content?
Oh, Sarah, such a great question. So that is my hope. That is still my biggest hope. And there are times in which people who have followed me, they have gotten it down. All of these things I'm talking about, the basic, they've got it because they've watched my videos. And so in certain encounters, yes, but I still haven't reached everyone. And so I haven't seen a great, decrease like, oh, I can get into the nitty gritty because you've gotten that basic foundation from my social media. I think we're not quite there yet. And I don't really have the capability of reaching a ton of my patients before they get to me because they're often referred by their pediatricians. And so it's okay. It doesn't bother me at all, but it allows me to then, when I'm meeting them, I want to have that framework and that foundational visit and answer all the questions they need. But then I say, if you have more questions about birth control choices, or if you have more questions about advocating for yourself, or I did a video about this, and if you want to, you can check out, the Instagram of the period doctor on there. They're like, oh, the period doctor, that's cute. Or they're like 10 and they're like, my mom won't let me get on Instagram. I'm like, I understand. But yeah, that's a great question.
Patient education is an actual like a printout, because I'm curious. I'm assuming just thinking about like the actual clinic flow, and this is something that we always go back and forth on. Of is it a link you're literally writing down? Go to the perioddoctor.com and you're going to find this video. Versus here's a printout from the organization or from the CDC. How do you see like opportunities for patient education?
Oh, I do everything. I think that you have to do every approach known to man. So I've got my vulva puppet. I've got I'm going to actually show you how to separate the labia and clean this area. I've got diagrams in my patient rooms that me and my nurse actually created because it was the way in which I give my, this is what a period is. This is the physiology of a period. And this is what hormonal contraception does. And I've broken it into, progesterone and estrogen only and progesterone. So I have diagrams in the room so they can look at it visually, and it has certain cues like this is monthly and this is weekly and this is every day. This is every 3 years. I have those things, but I'm also walking through them and I have a kind of a flow. And so it has a lot to do with the way I learn. I learn by reading, but more so when someone's walking through something and making gestures and kind of has some sort of visual that also accompanies that. I also print out things all the time. I print out things from the North American Society of Pediatric and Adolescent Gynecology, from youngwomenshealth.org. I'm constantly printing things out because I would rather patients have too much good information than not enough and have to be, looking at the misinformation that's online. Because when they do go online, a lot of the times that first Google search or that Instagram search or that TikTok search is not going to get them to someone who's reliable, reputable, who's accurate. And so I do all the approaches, every approach known to man, drawing things, writing it out, a dry erase.
Do we still have you? Okay. I don't know if my internet just dropped and my heart just dropped.
Oh no.
I'm getting it.
I kind of feel silly that I rushed through this. I was thinking that I was going so over time. My apologies.
No, this is great because you're actually getting a lot of questions that are coming straight to me.
Good.
And
I have
I
so
think
much more to say.
a lot of our work, I will say, a lot of our work is this real, authentic engagement with
Yes.
with you know with people, and it's getting all of this information. So something that we sometimes can struggle with is that the term preconception health, it doesn't really sit well with many people, but it also it's also an important, we want people to enter pregnancy if they so choose as healthy as they can be. It also covers decades of someone's life and multiple types of conditions and all people. So sometimes it's hard to not be vague.
Right.
So how do you, when you're putting your content together, because really wellness and health, how do you decide on, what are some really important things that we've got to get covered?
Yeah.
Because
So that's,
because it can be through the roof.
Well, it's amazing because social media is so dynamic that as you start to share and as you start to build your platform, it's almost as if it's like if you build it, they will come. You see that when you're posting something. So let's say the reason the preconception thing came up is because I posted something about Black maternal mortality and some ways in which I felt like people could best combat that, instead of, obviously it's not the patient's responsibility to make sure that they don't die in pregnancy. It's just like, the system has to do better. But when it comes to what you can do, preconception visits are a huge tool, to which people said, well, what's that? And so I'm like, oh my goodness, that's a perfect thing. My point is not being made if I say, oh, use preconception visits and leave the room and they don't know what that is. And so a lot of the time, just being present and having those conversations, I start to identify, or people literally gift me, the gaps and the things that I need to cover. And so a lot of that is just 20 people have messaged me and said, I need to explain what a menstrual cup is because I said it in this other post. And so now I need to do that. Or people have said, is the tampon the only thing that's inserted that, would collect or help manage period blood? Or people have said, I just never understood what a pelvic exam was. Or what's that speculum thing again? That's what happens. And so I say, I've got to address that. It's not that I organically just come up with these things that work perfectly for patients. You have to be where they are. You have to be engaging with them and creating a back and forth flow in a safe space to really see what they need. And my patient care in the clinic is so much better because of it. Then I say, there's this thing going around where people think that blah, blah, blah. Or a lot of people actually don't understand this. Do you understand? They're like, no. I even learned from other providers, asking things as simple as, before asking a kid, have you had sex? Saying, do you know what sex is? Like, starting in the right place. Or is it okay if we talk about your weight today? Do you have any feelings about your weight? Just being a better, more compassionate doctor. And so there's so many bad things about social media, truly, when you think about it and the ways in which it can affect people. It's beautiful to be contributing to the good, and being able to find the good. And so it's coming up with content can be very challenging, but the more you're in it, the more you engage, it will literally come to you.
Yeah, it sounds like you're doing a lot of listening, and that does then affect what happens during visits. And I will say, even in my own, they'll do blood pressures, and I'm like, I don't know, is that good? Are those numbers good? I don't know. Okay. Good.
Yeah. And so,
I started for them to validate you. I don't know if the numbers change.
I changed the way I even approach, like I have my clinic intake form. And so I've changed the way I made that so that it could be teaching at the same time. So I would say things like first period, that's menarche, and kind of put in order of kind of how it should occur. And then I say, hey, your first period was at age 10. Did you think that was a little bit early, or did you think that was on time? What did you think? And they're like, oh my gosh, so early. Like, I told people I started my period way too early. I'm like, actually, the normal range is 9 to 15. You were right on time. They're like, oh, yeah. And so you're releasing this thing that this teen may have carried with them for 20 more years, thinking that they started off abnormal. And so there's so much empowerment that you can just get by just listening and seeing that, oh, wow, when I explain it this way, they don't get it, because
that is so touching. You really are changing. You could possibly, changing someone's life in that visit. They really did carry, like,
I genuinely
believe early bloomer.
I believe I'm doing life-changing work, and I love it so much. And so extending that beyond my clinic is hugely important.
I'm going to move to the next question.
Yeah.
We have, as you talked about, there can be so much information and misinformation about health on the internet. Do you have any advice for how to be a smart consumer of info, or give advice, or the advice you give to patients?
Absolutely. So a lot of the time when I have patients who are like, well, and I get a lot of TikTok based questions. If you get in the pool, does that stop your period? I'm like, why would it? Like, and so I say, why would that have, they're like, well, they say it on TikTok. I'm like, well, now I'll just ask questions. So who says it on TikTok? Are they a doctor like me, or are they someone else? And why would they know that? And so those are the questions that we just have to be critical consumers. What that looks like is, who is this person? Why would they know this thing? If no one else has ever said this, no one else has ever solved this, and science doesn't support it, why would this be true today? Are they benefiting from me believing this? If me believing this means that I pay for something that I otherwise wouldn't have bought, if me believing this means that I repost something or subscribe to something that I otherwise never would have subscribed to, then it would suggest that maybe their intentions are not quite as pure as we would want them to be. So the people that are good resources are going to be physicians. And it's sometimes confusing because people will use a number of titles like vagina expert. What is a vagina expert? It is nothing. It is not a real thing, And so I know. And so I've tried to, you want to be very cautious because, again, social media has its role of talking to peers. Not everyone has to be, a person with a ton of credentials to be worthy of using social media and sharing their voice. But when it comes to what you take in and what you use to apply to your life and even utilize or trial that could potentially harm you, we really need to be careful. And that's the same way. If if someone promises that this fixes something for every single person in the world, then they're likely not telling the truth because there's always exceptions. So as a physician, I'm always going to say, this doesn't work for everyone. This works for this percentage of people. If it doesn't work for you, it's okay. There's always going to be a plan B. There's never a catch-all. There's no magic pill for anything. And so the caution when it comes to that misinformation out there has to be something that's continuous, that's constant, and you need a strategy. And if you're not sure, ask your doctor. That's really one of the best kind of, tiebreakers. Like, man, this is sounding really convincing. Just ask your doctor. Ask your doctor, and we should be able to at least give you some guidance. And sometimes I'll say, it might not hurt. There's no reason it should help. But if you feel like you just want to steam your vagina because you think it's cute, sure, don't burn yourself, It's unlikely to disrupt your fibroids or do anything meaningful. But if this just makes you feel calm, I'm not going to shame you for wanting to seek alternative methods to something that medicine can't solve, right? Because that's the reality of it. The majority of the time, medicine, whatever we've come up with, whatever we're offering, is not satisfactory for a patient population. And so even the desire to look for other causes or other kind of, treatments suggests that there's a gap that needs to be filled. So there's always an opportunity to listen. But I just want people to be cautious and careful. And, if someone has no credentials and no accountability, it's hard to trust them or to do something that could damage your body because they said to do so.
We have two questions that are somewhat related. One of them is a little bit longer, so it's going to take me a minute to read through it first. But the other one is about, so one, a shout out to Sonia and Renee Taylor's Radical Self-Love, something that you had just mentioned as well about, does someone gain from your self-love and your joy? So just wanted to shout out to that. And then also the question being, so sometimes evidence-based can it can interfere, the term evidence-based can interfere with cultural norms, and especially being a pediatric or, working with young adults, and, where, grandmother or mom, they do it this way, and this is very much a cultural norm. What do you do to help demystify misinformation that are maybe things that are generational, that have gone way back and really ingrained in someone's culture?
Certainly. So, that is a big part of what I do because I really have two patients, right? I've got the patient in front of me and then I've got their parent, guardian, whoever. And there's a lot of grandmothers raising in this world. And so I have definitely encountered that kind of generations old, like that grandmother, just is done with it. So one example is on my intake form. Of course, I'd hand type this intake form, is sex assigned at birth. And so I've got female, male, intersex, and then none. Gender identity, girl, woman, boy, man, non-binary, other, and pronouns. And I had a grandmother get very upset with me for even having this on the paper. And she actually wrote woke bullcrap on the paper. And I was just like, what? I asked the patient, I said, did you write this? She's like, no. But she knew her grandmother had written it. I went to the waiting room. I said, did you write this on my paper? And she said, yes, because I just don't believe in that. And I said, that's super interesting. This is real. And this is my paper. And you're in my office. And so what I get from that is that you're trying to send a message to me that's actually very disrespectful. So if you want to put down the pronouns that are appropriate for your granddaughter, I can help you walk through that and what that looks like. And she, started saying, well, she and her. I said, look, you already answered them. It's she and her and girl and woman. You just circled them. I put them on the left so they're the easiest ones to find. That's not a point of arguing. But let me tell you why this matters. There are people out here who do not fit into these categories exactly how you would want them to fit. And it is more important that I acknowledge them and let them know that I care than to make you upset today. And so as long as you're in my office, we're not writing words like that, because I'm going to treat your granddaughter, everyone else in here, with respect. Do you understand? And she was like 60 and she's like, well, yes, and I'm sorry, but it was so nuts to me, but you have to address it. So that's one example. Another example is a mom who, the daughter was saying that she didn't use tampons or so. I asked, you use tampons or pads? And she goes, pads. And, I was just like, okay, why'd you say it like that, girl? It was a simple question. She's like, I didn't use tampons. And her mom's like, she better not use tampons. I said, oh, interesting. Why? And she was like, because tampons take away virginity. I said, oh, interesting. Okay, tell me more about that. And the mom kind of sat there and she was like, well, I was told that tampons take away virginity. I said, do you mind if I talk about, this a little bit more? Virginity is not a medical diagnosis. There's a lot of hesitancy that maybe the tampon could tear the hymen. That's exceptionally rare, but it isn't related to actual virginal status. Have you ever wanted to wear a tampon? The patient's just like, I wanted to go swimming. I'm like, all she wants to do is go swimming. This is not a matter that has to be sexualized. It is okay to wear a tampon. And I'm not going to argue with that mother, but I'm not going to lie to my patient either. And so I'm going to say, I'm telling you, as a gynecologist, that this does not harm you. It doesn't take away your virginity, and it is appropriate to manage periods. And we shouldn't shame girls for doing otherwise. If you choose to not use tampons, that's perfect. If pads are your favorite and your jam, you do that, girl. But we are not going to lie in my office for the purposes of perpetuating cultural norms that make us feel better, but they actually harm us in the long run. So those are some of the ways in which I approach it. And it is almost on a daily basis. And it is great because it makes me, I have to choose my words very carefully. I tend to just ask more questions and you really get to the root of it. And at the end of it, I try to resolve things. The majority of the time, the kid just wants to be healthy and the parent just wants them to be healthy. And you can often reach some common ground if you listen and if you try.
Thank you. And I really appreciate the inclusivity that you brought up with especially with the screening questions. That's something also that our team has really tried to adapt and really build and bring into this conversation. Yeah. There are probably 10 more questions in the chat, and I think we're getting close to time. And I wanted to give you space to any other wrap up. I wanted to give you the last couple minutes. Any other advice you have to health providers or health teams, or really if there's a public health organization, someone that's that wants to help combat misinformation or share information about COVID vaccines or whatever the topic may be, how to get started and how to really engage and resonate with the public.
Yeah, so I think there is a misconception that the social media world is oversaturated, or I don't have something to bring to this space, or my voice doesn't matter. And it doesn't matter what your organization is doing or who you care for. They need you. And seeing you and your presence on social media, it really adds another layer to your commitment to your community. Saying, not only am I here for you in this brick and mortar building, I'm coming to you on social media to show that I'm here for you here as well. And I think that the social media aspect of my career and my medical education has transformed me as a provider. It has definitely made me a much better physician to the patients that come in my office. And it it doesn't matter that someone somewhere doesn't get it, right? I don't care that there's some executive in my hospital system that doesn't get my social media. There's 70,000 people out there that get it, okay? And it's not that there has to be sheer numbers, but I assure you the impact, the person you will reach, the people you will reach, the person you'll encourage, the person you'll educate, that is way more important than someone who's just kind of like, why do they do that? Why did she post a picture today? She's so self-absorbed. You know, that's not important. Why does she need to have music behind that? Did they have to dance to tell me about? Who cares? It is helping people, and we need to be creative in our approach. The reality is that the world is changing. Social media is where people are. It's how we reach people. It's how we affect change. And if your commitment is to affect change and to be an advocate for people, it's where you and your organization need to be.
There's a vulnerability to that as well. And so I will say I am so thrilled to be in community with you today, and could not be more proud to have you as a keynote during this Future Forward conference. I felt so inspired by everything that you've shared. I'm sure our team has as well. Thank you again for your time. I so appreciate you being on here and inspiring us and enlightening us with opportunities to really make changes and change people's lives. We can change the narrative.
Yes, thank you so much for having me. I love this opportunity. I'm obsessed with questions because I again love to listen and learn. And so if people want to send me questions, please feel free to send them to me on Instagram. I cannot promise that I'll get to you today, but questions about my social media, I'm happy to answer.
We did have a bunch we weren't able to get to, and I will do my best to keep to save them, and hopefully we can answer them. I can send them to you on social media, perhaps.
Awesome. Thank you so much.
Bye.